Hello everyone, myself Dr. Priyanka, postgraduate third year, Department of Oral and Maxillofacial Surgery. Today we'll be discussing about Lefort fractures. First we'll start with the introduction. The middle third of the face, it is the area bounded superiorly by a line drawn from the zygomatico-frontal suture across the frontonasal and frontomaxillary suture to the zygomatico-frontal suture at the opposite side. Inferiorly, it is lined by the occlusal plane or the alveolar ridge. Posteriorly, as far as the frontal bone above and the body of sphenoid below. Now the bones which comprises of the middle third of the face, there are 8 paired bones and 2 unpaired bones. Paired bones, it includes 2 maxilla, 2 palatine bones, 2 zygomatic bones, 2 zygomatic process of temporal bone, 2 nasal bone and 2 lacrimal bone. The unpaired bones, it includes ethmoids and its attached conchi, the inferior conchi, the pterygoid plates of sphenoid and the vomer. Now comes the classification of midface fracture. The most accepted classification of midfacial fracture was given by René Lefort in 1901 as Lefort 1 fracture, Lefort 2 fracture and Lefort 3 fracture. Erich classification in 1942, it is based on the direction of fracture line as horizontal fracture, pyramidal fracture and transverse fracture. These are the further classification of midface fracture. Now we'll be discussing about Lefort 1 fracture. It is also called as horizontal fracture of maxilla, Guerin's fracture, floating fracture, lower level fracture, pterygomaxillary dysfunction and subzygomatic fracture. When the violent force over a more extensive area above the level of teeth it occurs, it will result in Lefort 1 fracture. The horizontal fracture line seen above the apices of the maxillary teeth, detaching the tooth-bearing portion of the maxilla from the rest of the facial skeleton. The fractured fragment is freely mobile and displacement will depend on the direction of the force. Depending upon the displacement, a variety of occlusal disharmony can be seen in this type of Lefort 1 fracture. Now, the fracture line, it starts at the point on the lateral margin of the anterior nasal aperture. It passes above the nasal floor and it passes laterally above the canine fossa and then it transverses the lateral antral wall, dipping down below the zygomatic buttress and then it inclines upward and posteriorly across the pterygomaxillary fissure to fracture the pterygoid lamina at the junction of the lower third and upper 2/3. At the same time, from the same starting point, the fracture also passes along the lateral wall of the nose to join the lateral line of the fracture behind the tuberosity. Lefort 1 fracture, they are mostly bilateral. Sometimes they are unilateral depending upon the direction, displacement and severity of force. It may occur as single entity or with Lefort 1 and Lefort 2 fracture. Now the signs and symptoms of Lefort 1 fractures are, extraorally you can see slight swelling and edema of the lower part of the face along with the upper lip swelling, ecchymosis in the labial and buccal vestibule as well as contusion of the skin and the upper lip. Bilateral epistaxis may be observed. Pain while speaking and moving the jaw. Occlusion may be disturbed. The most common significant feature is the mobility of upper dentoalveolar portion of the jaw, which is frequently mobile to digital pressure, and air emphysema in some cases. Intraorally, you can see floating maxilla because there is complete separation of dentoalveolar part of the maxilla. Impacted or telescopic fracture. Why it is known as impacted or telescopic fracture? Because sometimes there will be upward displacement of the entire fragment, locking it against the superior intact structure. That's why these are known as impacted or telescopic fracture. Anterior open bite, disturbed occlusion, ecchymosis, cracked pot sound on percussion of the maxillary teeth, mid-palatal split in some cases, damaged teeth and Guerin's sign. What do you mean by Guerin's sign? It is characterized by ecchymosis in the region of greater palatine vessels. Now comes Lefort 2 fracture. It is also known as pyramidal or subzygomatic fracture. It occurs when violent force in the central region extending from glabella to the alveolus, it results in pyramidal fracture. The fracture line, it runs below the frontonasal suture from the thin middle area of the nasal bone Down on either side, it crosses the frontal process of maxilla and then it passes anteriorly across the lacrimal bone, anterior to nasolacrimal canal. From this point, the factual line passes downward and forward and laterally crossing the inferior orbital margin in the region of zygomatico-maxillary suture. It may or may not involve the infraorbital foramen. The factual line, it extends downward and forward and lateral to the transverse wall of the antrum, just medial to the zygomatico-maxillary suture line. The sign and symptoms of Lefort 2 fracture are: extraorally you can see ballooning or moon face, bilateral circumorbital edema and ecchymosis, subconjunctival ecchymosis, edema of the conjunctiva or chemosis, detection of a step deformity in the bone of the infraorbital margin. It is the most important in differentiating Lefort 3 fracture. Mobility of the midface, anesthesia or paresthesia of cheek, diplopia, possibly you may see diplopia, CSF rhinorrhea, no tenderness over or disorganization and mobility of zygomatic bones and arch, elongation or lengthening of the face, emphysema of soft tissues and nasal disfigurement. There you can see CSF rhinorrhea and ballooning or moon face or football face deformity. Intraorally you can see disturbed or dearranged occlusion, posterior gagging of occlusion with retropositioning of maxilla with anterior open bite and airway obstruction. Now comes Lefort 3 fracture. These are also known as high level fracture, transverse fracture, suprazygomatic fracture, craniofacial dysfunction. Due to severe impact from the lateral surface, Lefort 3 fracture occur. The fracture line starts near the frontonasal suture. It causes dislocation of the nasal bones and disruption of the cribriform plate of the ethmoid bone. Then the line crosses both the nasal bones and frontal process of maxilla near the frontonasal and frontomaxillary sutures, and then it transverses the upper limit of the lacrimal bones. The sign and symptoms of Lefort 3 fractures includes hooding of the eye, dish face deformity, periorbital edema and ecchymosis. Bettel's sign, it is also known as mastoid ecchymosis. It is an indication of fracture of the posterior cranial fossa of the skull and it may suggest underlying brain trauma. Panda feces or raccoon eyes, subconjunctival hemorrhage and chemosis. Intraorally you can see disturbed or dearranged occlusion, posterior gagging of occlusion with retropositioning of maxilla and anterior open bite, airway obstruction. Sagittal fracture of the palate is a variant of Lefort 3 fracture. Thank you so much.